Welcome to my podcast. Today I'm going to talk about another condition, basically in females. So a patient will come to you and says, Doctor, I'm having itchy down below and there is some discharge. So after you introduce yourself, double check the patient name, date of birth, you'll ask her, how can I help you? And tell me more about this. So the patient will say, I'm having a discharge, which is really itchy, and it's really annoying. So after all of that, you're gonna ask, does it smell, for instance? What's the color? What's the amount? And you will ask also if the patient is sexually active and since when. And you will ask her if there is anything that the patient is using, like douches or bubbling bath, and how many sexual partners does she have, and if there is any history before this incident at all. And also you need to inquire and make sure that patient if is pregnant or not, and ask about the last menstrual period. So that's basically just certain questions that you need to ask, and then you need to just get an idea what might be the reason for this presentation. So if the patient says the smell is awful, it's fishy, and the discoloration could be grayish or whitish, that might go in favor of something called bacterial vaginosis, which is basically not a sexual transmitted disease, but it could be associated with others, sexual transmitted infection. It's basically the change of the natural balance of the bacterial flora and become more alkaline rather than acidic, and it could cause all of that. So in that situation, you will ask the patient that she need to, if she's using any vaginal douches or bubbling bath or shampoo in the bath, all of that she need to avoid. Also, the patient using certain perfumed product in the bath or around her private area, she should refrain from that, and also avoid, making love. And it has been stated also to avoid smoking if the patient is a smoker, or if that you need to bring their attention about this as well as a factor or a risk factor. And also you need to ask the patient just to keep clean and not to worry, and just of course send for certain investigation, like just rule out if there is any sexual transmitted disease or infection at all. And of course, if the patient have any ideas or thought what might be the reason for this, you need to explore it with the patient. And if there is any concern, you need also to rule that out. If there is any discharge, of course, you need to send for swab and culture. Just take swab and send it for culture. And the treatment, as we all know, it's mostly flagyl tablet, which will be given and prescribed for the patient in those situations. You will just tell her about certain things that she needs to do and avoid. Like, for instance, she should stop doing baths and just take a quick shower and use water and plain soap to wash the area just for cleaning. And as I say, avoid any perfumed soap, any deodorant, any bubbling bath, smoking. Wash her underwear regularly. Avoid any polyester or tight fitting until she feel better and until the itching improve. There is no basic known causes, of course, for bacterial vaginosis. Just it's a change in the bacteria in the bacterial flora around that area, and you need to ensure that the patient follows just the normal measure, because certain ladies use certain deodorants, certain bubbling baths, and perfumed products in their bath when they take their bath. Also, because certain patient, they might think this is a sexual transmitted disease, you just need to explain it's not, but it could increase the risk of some other sexual transmitted infection like chlamydia, and just need to stick to one partner, and just need to take her treatment for the regular 7 days. And the other differential is trichomonas vaginitis, which is basically there is just certain difference between them that I will talk about in another podcast. Thank you.